Um, Hello, everyone, and welcome to today's BSL Talks webinar, a systemic change approach to developing a modern health and human service workforce. My name is Dr. Joseph Borlagden. I'm the Principal Research Fellow in the Youth Opportunity Team in the Social Policy and Research Centre at the Brotherhood of St. Lawrence. And I lead our research and policy work on youth employment. And today I am speaking to you from Wurundjeri country in Naarm, Melbourne. And I'd like to pay my respects to elders past, present, and to all the Aboriginal and Torres Strait Islander elders from the lands on which you are joining us and who are with us today. I'd also like to acknowledge that this is land that was never ceded. The panelists today are joining us also from the lands of the Wurundjeri country, but also the lands of the Gadigal people of the Eora Nation. Before we begin our discussion, I'd like to go over some housekeeping details. We welcome Brooke and Amber, who are our Auslan interpreters for today. Closed captioning is also available by clicking on the CC button at the bottom of your screen. If you do have a question for the panel, please use the Q&A feature, which is also at the bottom of your Zoom screen, and we'll try our best to answer all of your questions. The chat feature is also available if you wish to make a comment. If you're on social media, don't forget to tag us at Brotherhood Info. And also use the hashtag BSL Talks if you're going to be tweeting out. Today's webinar will also be recorded, so if you do need to drop out for any reason, you'll be able to catch up on the conversation later. If you registered for the event, we'll email you a link to the recording. Okay, thank you. Let's get into it. So in the lead up to the Jobs and Skills Summit, Skills and Training once again is taking centre stage as the forgotten driver of economic productivity. There's a sense of opportunity here that the summit will be a window where national policy can perhaps line up skills and training with the needs of industry. There's also a sense of optimism in partnership between government, employers, unions, and the community sector, all working together to address skills shortages. And this is especially important in the health and human services. This sector makes up the largest share of our workforce. It's a sector projected to grow, yet the rates of entry-level training for those occupations aren't keeping pace with demand. Now, skills shortages in health and human services is a priority, but our current workforce and skill solutions just aren't cutting it. So existing career start training models are too narrowly focused on training people up for specific occupations, and they don't set up young workers in particular for career mobility. We also tend to rely on micro-credentials to support workers moving in from other sectors. So in short, they're one-size-fits-all solutions that don't respond to current conditions. They're not really grounded in the dynamics of local labour markets. Now, getting this right matters, not just for our nation's productivity and to address critical skill shortages, but also for building a better deal for our young people. Youth unemployment still sits at just above double the adult rate. Full-time work for young people has fallen over the past decade. And over that same time, we've seen zero wage growth for young people. And so young people are fast losing hope in the systems that are meant to help build a sustainable livelihood. So while we still need skilled migration, we also need to build a skilled local workforce and begin to look at young people as a resource. It's really in this current moment that we think deeper radical change is needed. So the time is right to explore a new national workforce development institution, one that recognises the value of what we're starting to call the modern service worker in the health and human services. So I want to pass on now to my co-facilitator for today, Kira Clark, who is the Senior Research Fellow in the Youth Opportunity Team. If you do anything in the skills and training sector in research and policy, I'm sure you'll be familiar with her work, and she's going to situate more of today's talk and also introduce our panel. Over to you, Kira.
Thanks, Joseph. In the lead up to the Skills and Jobs Summit that's coming up, the Federal Minister for Skills and Training, Brendan O'Connor, has regularly referenced the particular workforce and skills challenges facing the health and human service sectors. And he's also used the language of future-proofing. And future-proofing has been a consistent fixture of the recent policy rhetoric in the lead up to the summit and ever since the federal election. At the Brotherhood, our understanding of what a future-proofed skills system needs to look like has been shaped by more than a decade of research, policy and service delivery work on youth employment. Most recently, this has been through the National Youth Employment Body. We've been working with a range of community, industry, employer and training partners in place, including through running a national skills trial in 2020 that enabled pathways to entry-level age disability care roles. What we've learned through this work is a lot, but particularly we've learned about the structural barriers within the skills and training system. There's no doubt of the need for meaningful system reform. But what is also clear is the need for multiple speeds of system reform. What is needed is an ambitious policy vision that can encompass both near and long term. That encompasses both the near-term rebuilding of a skilled health and human service sector workforce and the long-term planning for skill system agility that can adapt to changing and evolving workplace practices and hopefully more diverse workforce entrants in the decades to come. But designing this new system vision requires a really joined-up effort. It needs to reflect the occupational intersections and workforce mobility within health and human service institutions and place-based local service provision ecosystems. And as Joseph said, there's no one-size-fits-all, there's no cookie-cutter solution that's going to work. From our work in diverse communities like Warrnambool and Shoalhaven, Logan and Darwin, we have seen the importance of redistributing the power for co-designing training solutions that are responsive to the care sector employers, job seekers and existing workers within those communities. But that place-based training responsiveness must sit on a shared national platform of an updated configuration of the modern service worker within the care sector. And so that's the problem we want to talk through and address today. How can we reconfigure the occupations within health and human services to better align with the workforce development needs and occupational mobilities that support integrated models of care? To tackle this problem, we're joined by three expert panellists who each bring a vital vantage point to the discussion. I'll start today by posing a question to each of the panellists to help us frame our shared understanding of the workforce and skills problems facing the sector. Then we'll move into some solution-focused questions for the whole panel. We'll also have time for questions from the audience, so please send them through as we move through. Our first panellist is Jody Schmidt. Jody is the CEO of the Human Services Skills Organisation, or the HSSO. Jody has held several senior leadership roles within the training sector, including as the Deputy Director General Training and Employment with the Queensland Government, and then as the inaugural Chief Executive Officer of TAFE Queensland. She's also served as the Chair of the National Education and Foundation Skills Industry Reference Group, and has been a member of several national review and expert panels. Jody, we keep hearing about the labour and skill shortages facing the health and human services sector. From your vantage point at the HSSO, do you want to start us off with an illustration of what these skills and labour shortages look like?
Thanks, Kira, and thanks for the opportunity to participate today. And I also want to extend my respects to the custodians and the original custodians on the land on which we gather today, elders past, present and emerging, and acknowledge Aboriginal and Torres Strait Islander people with us today. I'm going to share my screen, provide some stats and demographics around the health and human services sector. As kind of preluded by Joseph, the Human Services Skills Organisation has been established to make sure that we're looking at the overarching workforce challenges of the human services sector. And in doing so, we spend a lot of time sharing this data. And what we found is a lot of people aren't aware that the size of the health and human services workforce is the largest industry in the Australian labour market and has been the largest contributor to labour growth since the 1990s for a range of reasons that no doubt we'll explore today, including our ageing population, our bias towards healthcare and health prevention, and the way in which the community services sector has developed. And there are, of course, other contributors. When we look forward in terms of the projections of the sector, and I'll just get my slides to move. When we look on the forward projections of growth out to 2025 looked like 250,000 additional workers. If you compare my first slide to the second, you'll see that the growth in this sector is already outstripping expectations. And as we look towards 2050, it goes markedly up. So what we know is that the demand for services in health and human services is going to continue, and perhaps at a trajectory that is greater than what we've already seen. But just looking at today's figures, it is double the size of any other sector in terms of labour market demand. And of course, that's been exacerbated by the pandemic and the effect the pandemic has had on this workforce. If we look at the detail, we use this slide to show that really there's nowhere to hide in any of the categories here. We're looking at double-digit growth across the board. And that means that we need, as we've already said, a systemic approach to how we're going to address the shortages that exist today. Because whilst I'm talking about growth here, we also know, and it's been well reported, that there is significant vacancies across the sector right now. And we can demonstrate that by the recruitment rate month on month. This shows the subsectors of these industries that show employers and the percentage of employers who are in market recruiting month on month. And we spend our time talking to employers who have hundreds of vacancies on a month-to-month basis that they're looking to fill, and they're competing in market in tight timeframes in order to be able to deliver their services on the ground. If we think about what the topics that we might want to talk about today are, understanding the criticality of the requirements and the growth coming to these sectors, and then thinking about the attractiveness of the occupations and or jobs that we know about in these sectors, and making sure that they can be filled is critical. And as Joseph referred to, these are sectors that to some extent have been dependent on migrant labour in the past and will continue to be, but we'll also need to have a sustainable Australian workforce, and he was very clear about that. How we work together with industry, government, unions and other stakeholders to address that is going to be critical. But it has to start with appropriately valuing and understanding what the economic implications are if we don't create a sustainable workforce. As we work, what we understand is that in many instances, these industries and the employers within them have had a huge amount of change. And so therefore, the models of care and the models of delivery that they're undertaking and the job design that they're using in terms of deploying workforce is not as sophisticated perhaps as what it could be. And the opportunity exists for us to think about how do we leapfrog over existing models of care and think about how we can create a workforce that's more readily able to take advantage of the skills that it needs to deliver into the future. And so therefore, the mapping of job architectures and skills requirements so that we have that understanding and we take our lead from other economies who are working in this way so that we can create clear and attractive career pathways to attract people to these sectors will be critical. No doubt we'll explore as we move further through the other panelists' points of view what some of those things or opportunities might be, but understanding the breadth of this sector and the skills that can be deployed and the satisfying careers will be part of that in terms of what might be the solution. I'll leave it there as the intro, Kira.
Thanks very much, Jodie. Certainly paints a very stark picture of the requirement for urgent action. Looking forward to digging into some of those key issues as we move through the discussion. Our second panellist today is Dr. Damien Oliver. Damien has worked in research and leadership roles across the vet sector, including at the National Centre for Vocational Education Research, University of Sydney, UTS, New South Wales Skills Board and TAFE New South Wales. Damien is currently the Assistant Secretary of Pricing and Performance in the National Skills Commission, leading the NSC's work on pricing of vet courses and the development of outcome indicators for the vet sector. Damien, throughout the last few years, there's been consistent public and policy discussion about misalignment and the need for alignment between supply and demand, and whether training activity is lining up with job demand and where employers are really needing skills. The National Skills Commission's recent work on the National Vet Data Asset has been looking closely at labour market destinations from vet courses. What does this reveal about the education to work transitions for health and human sector vet courses?
Thanks, Kira, and hi, everyone. It's great to be joining this webinar this afternoon. So I'm going to draw on just a little bit of the data that we were able to present to the recent NCVER No Frills conference back in July, where we presented the first results from the Vet National Data Asset. So the Vet National Data Asset, or VANDA, is a linked asset that joins together the administrative data, the copious amounts of administrative data that registered training organisations are required to submit to NCVER. It joins that data to administrative data sets that the government has assembled from its taxation records, from its social security records, and places that together under the secure custodianship of the Australian Bureau of Statistics, and makes it available for researchers to analyse. So it's a tremendous resource, and so I'll start out by acknowledging the support and centrality of the Australian Bureau of Statistics in the analysis that we've started to undertake. So what VANDA will enable us to do is over time build a very rich picture of the transitions of Australians through vocational education and training, through the apprenticeship and traineeship system, and through higher education as well, into employment, as well as their kind of interactions with other parts of our society, including the social security system, and indeed re-entering education and training successively as they go about their careers. So it's a really exciting development. We are at the very early stages, and so in July we were able to share one small picture of that. What we did was look at the occupational destinations of graduates who had completed a vet qualification in 2018-2019. So, in doing that, we found a lot of similarities, as we expected, with what's already known from the Student Outcome Survey, but have some beginning early analysis of some new insights that will come from the much larger data set that VANDA represents. So we found three patterns across the data, across the different range of vet qualifications, which we called tight matches with the labour market, dispersed but matched, and finally dispersed and not matched. So the example that we identified for a tight match between vocational education and training and the labour market was the Certificate 3 in plumbing. And there we found that over 90% of plumbing graduates go on to work in one of just three occupations that have a very clear connection with plumbing, whether directly as a plumber or as a building and plumbing labourer. Of significance for the topic of this webinar today, the second group, the best leading example we could find of training that leads to dispersed but matched outcomes related to the Certificate 3 in individual support, which I think most of us would agree is the cornerstone qualification for the human services sector in Australia at the moment, at least as far as VET is concerned. So what we found in relation to the Certificate 3 in individual support is that around about 60% of graduates entered into one of three occupations that are quite closely related to one another and pleasingly have some connection with the sector. So aged and disabled carers, nursing support and personal support workers, and welfare support workers. So depending on your point of view, that might lead to a glass half full or a glass half empty assessment of the current situation. We have around about 60% of people who have completed the qualification. So we haven't looked at non-completers in the analysis, who completed the qualification going on to work in one of those three roles. If you add in registered nurses, which interestingly pop up at around about 7% of Cert 3 in individual support graduates, we probably have around 2/3 of Cert 3 in individual support graduates working in very closely identified roles in health and human services. Which leads us to the question, and unfortunately today, maybe it's the rule of show business, leave them wanting more, but it'll just be a question today. What happens to that other third of Cert 3 in individual support graduates? What is happening that means that they are not going on to work in roles that do have that strong alignment to the sector? So that's part of the, I guess, ongoing work of the National Skills Commission, and look forward to somehow, someplace updating all of you on what we find in the future.
Thanks very much, Damien. Definitely the rules of showbiz. Drip feed, I can feel data nerds across the country celebrating in the possibilities that are coming out of that new platform. Thanks so much for giving us a bit of an insight, particularly in relation to the Cert 3 individualised support and some of the patterns coming out of that one. Moving on to our final panellist. Our final panellist today is Professor John Buchanan. John is currently Network Leader for the University of Sydney's Health and Work Research Network, consortium involving experts from the business school, medical, health sciences, and 4 other faculties. John has authored several seminal works on labour markets, workforce development and skills, including as one of the authors of the 1999 publication Australia at Work, Just Managing, ? And as co-editor of Inclusive Growth in Australia, Social Policy as Economic Investment in 2013. John, this is obviously not the first time Australia has tackled intensifying skills shortages, nor the first time there have been questions raised about how specific jobs and occupations are structured. With decades of policy tinkering and reform, why haven't we solved this challenge yet?
Thanks, Kira, and I'd like to acknowledge the original custodians of the land on which I'm speaking, the Gadigal people of the Eora Nation here at in the space occupied by the University of Sydney, and we pay our respect to their elders past, present and emerging. Look, there are 3 answers to your question, why are we still in the situation we're in? The first one is pay. Fundamentally, we hear a lot of talk about skill shortages these days, but it's overwhelmingly a problem, a shortage of decent work. The carers we're talking about in this sector are amongst the lowest paid workers in Australia, and you don't have to be Einstein to work out that if you don't pay people well, when they get other opportunities, they'll move on. Even higher up the occupational hierarchy with nurses, they're given the demanding conditions of that work, there are real problems there. And that's the second thing. It's not just pay, it's conditions. I've been studying and working with nurses for over 20 years now, and they've done remarkable things in reducing work intensification with things like nurse-patient ratios, but they were starting from so far behind, they've still got a long way to go. And over the last 5 years, the proportion of people who have registered as nurses but don't work in the profession has increased by 63%. So we don't have a shortage of nurses, we just have a shortage of jobs that they're prepared to work. And then the final and third element is there are problems with our system of workforce development. At the level of professions and where we rely on degree qualifications, the system works by and large pretty well. The real problem is what's going on below the degree level. And Alison Wolf basically says, this is the part of the education system that looks after other people's children. The vocational education system has been the plaything of policymakers who by and large don't send their children there, and we've ended up with a system which is highly fragmented, structured around the fantasy of a training market, and has created many opportunities for business model entrepreneurs to flourish, but it hasn't really embedded a deep system of quality vocational education. And if you want a quality system of vocational education, you've got to engage with the reality of occupations. Currently, our vocational education system is structured around industry-defined training packages. But if you look at the way people flow through the labour market, they don't fall into neatly defined industry categories. Occupations are ensembles of skill that bring together related capabilities. And our system has not been doing that for many years now. If I can just give you an example, I did work with the New South Wales Department of Education over 3 years, where we took longitudinal data over 7 years. We imagined 420 occupations. We tracked how people flowed across those 420 occupations over 7 years. And when you do that, you see that some people, as Damien said, he used the expression tight matching between qualifications and jobs, and that's very much the case in occupations, particularly around the skilled trades, like you mentioned, plumbing, to a lesser extent too also in registered nursing. But there's a whole part of the labour market which has what he called dispersed movements. And when you look at it, these are not random movements, these are not arbitrary movements, they actually tend to cluster. And if you look at the flow of people who do care work, they don't just stay in care. They move also into customer service work and then often into more advanced clerical work, project management and the like. Equally, sometimes people flow out of customer service work and into care work. And so that's where researchers that I've been working with at Sydney Uni use the term the modern service worker. It's not just a matter of the care worker, the clerical worker or the customer service worker. We want to look at how people move between those domains. They're doing it already. It's almost like a natural flow within the labour market. And so we think when we're thinking about moving forward, we've got to create a workforce development system that deepens people's capacity to transfer between these elements well. And it's this transferability that has been very limited in our system at the moment. And if we, as we're looking to the future, we've got to fix up the problems of pay. You're never going to fix up care work unless you pay people properly. We've got to fix up the working conditions, and that requires serious thought. But equally, you could get pay and the working conditions right, and if we still had our fragmented training system, you wouldn't solve the problem. So in looking forward, we've got to look at how do we cluster ensembles of related skill to give people the capacity to transfer as opportunities rise and fall across the labour market. Thanks, Kira.
Thanks very much, John. And thanks, Jodie, Damien and John, for sort of setting the scene for us. I think we've seen through those three introductions that there's undoubtedly a crisis, a skills and labour workforce shortage crisis for the sector and all of the subsectors within it. Looking at some of the data that Damien shared, on paper that there doesn't look like there's a problem initially with that qualification, like Cert 3 individualised support having an articulation that's potentially higher than some other areas. But then John sort of stepping through these different structural dimensions of the lack of modern reflection of what those occupational mobilities look like and how at a systemic workforce and skills level, we really need to update and refine the system to reflect that reality of the modern system. I'll ask John, Jody and Damien all to turn their cameras on now, and we'll look at some questions that take us forward. If these are the problems, the nature of the problem, how can we start to look for some transformational solutions? So in Jody's introduction, you touched on the challenge of job architecture, the need to do some more mapping and transformation of the job architecture. Maybe starting with the question, if we're really looking for a meaningful reconfiguration of occupations in health and human services, what are the job architecture changes that are needed, and what role does systemic power dynamics play in pushing for and enabling those changes? We'll go to each of you, but maybe starting with you, Jody.
Thanks, Kira. So some of this work is being undertaken at the moment, both in aged care and disability. And it's interesting work in that, as you talk to employers, the way in which a personal care worker or a support worker is deployed is different in each of those arrangements. The job design doesn't have what you might see in some more formed industries as some general understandings of how they're deployed and how that might work. And we're also seeing employers thinking about how they might deploy and push the boundaries of what the traditional roles of those jobs will be, such that we have a lot of topics coming up around what is the capacity of the personal care worker to be extended, how does that extend into the nursing domain, whether it be enrolled nursing and or registered nursing, and what does that mean in terms of care and support nursing and the clinical frame? And of course, we get into the issues of what the boundaries of scope of practice are, and the way in which we might look to other examples in frames around how we extend those scope of practice in a logical way to make sure that we're using the workforce to full capacity. And that means that we need to understand, as you called them, the systemic power bases there in terms of a range of things. And a great example might be allied health, where shortages in allied health in the disability sector particularly, but also in aged care, are showing that we aren't producing enough allied health professionals, physiotherapists, occupational therapists and the like to deliver against the NDIS. And therefore the question comes around, what is the role of allied health assistants and how far is their scope of practice likely to come? And that delegation model, whilst in its infancy, has some opportunity for us to explore in the same way that we haven't seen the role of nurse practitioners taken on board, perhaps in the Australian economy and in the clinical setting in ways that it has in other economies. And so when we think about the fact that we're going to need to build a workforce that is greater, but we're not going to have enough people to exponentially address it, we need to think about how we can create the productivity that we need in order to make sure that we can use the existing workforce to its maximum. And these things are going to come up as we explore what is the job role and how are those job roles deployed effectively. And we see some of it coming out of the Royal Commission into aged care, for instance. But have we got it right, and are we having the right discussions with the right professions right now, I guess is the question.
Yeah, thanks, Jody. John or Damien, have you got a view to weigh in on this one? What's some of the power dynamics that we need to be thinking about to start to shift the job architecture?
Well,
I might jump in very quickly because I know that John will have more to say, but my contribution will be modest, which is to say that I think that data can make a difference here, but isn't going to be enough in and of itself to change existing power dynamics. But it might help to expose some of the some of the more powerfully held positions that perhaps don't necessarily warrant that level of influence and control. So I'll give another plug for a National Skills Commission product, which is the Australian Skills Classification. And what we're trying to do there is break down the skills that are held by different occupations, not to atomise occupations, but to stress and expose the commonalities in skill clusters across jobs as a starting point to being for stakeholders to be more creative and more bold about how we might reconfigure the skills that we need, particularly where the skills classification brings to light evidence of which skills are most rapidly increasing in demand. So I'll leave it there and pass over to John.
Thanks, Damien. And it's a good question, Kieran. I like the Brotherhood of St. Lawrence because you asked pretty directly power dynamics. It's not a technical problem here. There's a question of power, and as an academic, I can speak pretty freely. And I do think that there is a power structure, what I call the Training Package Club, which is locked in around the current contours of the funding models and organisational design within our vocational education and training system. And this is a formidable force. I mean, there's training providers who make a lot of money out of the current system. There are people who have a lot of control over current arrangements. And the underlying idea is not how to give people transferable skills, it's how to make a training market work. And that's just the wrong problem. We don't need a better training market. We need an effective system of workforce development. And we need to engage with those occupational dynamics I talked about. How do you get ensembles of transferable skill together? And, you know, other people have asked this question over many years. And the Northern European countries and Germanic countries, Switzerland's a case I've been looking at lately, but they give young people access to a variety of occupations, not to train them just for that occupation to stay in it for life, but to provide a platform for giving them the ability to learn broader skills. So you don't learn problem-solving skills in isolation, right? So this is where the Swiss say they give people what they call methodological skills, like problem-solving, and social skills like conflict resolution, developed in the context of, say, learning about managing an office or learning about watchmaking. And you've got to anchor that general capability in a specific domain. Like I say, the classic example I like to use, somebody can face the problem of a fire about to break out on an oil rig. That requires domain-specific knowledge as well as creativity in unpacking the problem. But you could put a highly talented engineer on an oil rig in the middle of a childcare centre, and they'd have no idea how to handle 25 3-year-olds melting down having a tantrum. Problem-solving skills have domain dimensions, and I think we got as we think forward, we've got to break the current power structure, which is locked in around training packages, which have fragmented skills in very narrow and unhelpful ways, and have a broader debate about what are the ensembles of skills, what are the vocational streams and occupational structures we need to develop to give people transferable capacities as they respond to declines and falls in demand across the economy.
Yeah, thanks very much, John. And I imagine, the reimagining that skills and training entry point or pathway that does start with a broad base, that does look at those development of those transferable employability skills within those domains of knowledge, is linked inevitably to understanding those boundaries that Jodie was talking about between the different existing occupational classifications. I think what we see in our systemic change work is it's at this point of the conversation, it's often really hard with something as big and as hard to imagine moving as the training system, and something as large as the health and human service system, to really imagine what a transformed or different scenario could look like. To sort of help us not feel like we're reinventing the wheel, I think it's useful if we look at some examples. Are there examples at potentially a smaller scale where we can learn from what is possible when it comes to looking across the boundary of existing occupations, different case studies, frameworks in alcohol and drug roles, in Indigenous health, that we could leverage here to think about the change that's needed? Jodie, I'll come to you first.
Thanks, Kira. Certainly we see in areas of remote and very remote locations in Indigenous health that you, through need more than anything else, start to see the deployment of roles or individuals, and the thing that comes to mind is Indigenous health workers, who have the capacity and the general capability to fulfil a number of roles in terms of what we're talking about here, in terms of modern service work or integrated service work. So one of the examples that we think that we can demonstrate this in on a smaller scale is that, in essence, the Aboriginal health worker, or in some instances, the individual support worker working in Aboriginal communities, is working across, and we see this in mainstream as well to some extent. It's working across aged care, it's working across child and family protection, they're working with disability, they're working in the intersection between those sectors and delivering that care work based on their set of knowledge. And that would give us the further development of what those general capabilities are into a better scoped transitional set of skills development over time, we believe, from the HSSO perspective, and working with Aboriginal and Torres Strait Islander stakeholders across the coalition of peaks will give a better service delivery to underserved communities at this point in time, as an example. But I think John has some examples from other sectors that might shed light on how this comes to fruition, that will inform our work as we start to move through that. There is no doubt there is underservicing of remote and very remote communities. That is an opportunity for us to test some of this thinking that we're having right now.
Thanks, Jodie. John.
Yeah, look, the example I like to cite, and it's a relatively minor one and hasn't been entrenched, but it emerged in debates around how to manage the frail aged in the Greater Sydney area about 15 years ago, and the Greater Metropolitan Clinicians Task Force got together all the people involved in managing frail aged, and so these were geriatricians, doctors, physios, social workers, RNs, AINs. They had everyone across the occupational groups gathered, and they said, here are the projections for the ageing of the workforce, given, the ageing of the population. Given we know what comes with ageing and rise in dementia and the like, these are the increased demands. And when that was presented as a problem, the gerontologists got up and said, well, basically there's no way knowing with our current models of care that we can actually train enough people to meet that demand. And so they said, we're going to have to talk about how we work differently together. We're going to have to talk about drawing GPs in. We're going to have to talk about drawing in allied health in. And I think that notion of a clinical service network that starts with a problem is the way to go, because it was respectful of the professional expertise. It wasn't going in there and saying, you're blocking, you skilled professions are blocking this stuff moving. It was, how can you professions as a group solve a complex problem? I think that's there's real insights into that. The issue then becomes, how much authority do those interprofessional groups have vis-a-vis the centralised authority of a health department? And that's an unresolved issue, and you have to say at the moment health departments usually prevail over the power of interprofessional groups. But that's the space that we've got to explore. How can there be greater delegations given to interprofessional groups to solve problems, but not charged with the responsibility of carving up each other's jurisdictions?
So if we're wanting to leverage from those sort of examples, sort of the remote environment, Jodie, where maybe due to thin markets we see some boundary crossing within those integrated care roles that people are playing, and then from the example you provide there, John, in frail age within Sydney, looking to those examples, what would it take to leverage what we know about that at scale? What are the sort of political conditions, the systemic policy conditions at a national level that we need to be focused on to sort of test something like that across the system, where at this sort of, as Joseph said, window of opportunity, we're heading into a jobs summit, there's new Jobs and Skills Australia, there's a lot of focus on the sector. What policy levers do we need to be pulling to push for something like this at scale?
Well, I'm happy to kick off if you like, but I mean, I think one of the really good things that came out of the Rudd Gillard years was an institution called Skills Australia, and its great strength was that it did not run around telling everyone what the answer was and blackmailing them by not giving them money if they didn't do it. It took an openly pluralistic approach and said, we've got the skills system is incredibly complicated. No one party has all the expertise that's needed to make it run properly. And it tried to get build a community of engagement and dialogue that could confront these questions. So I think the feds they're like one step removed from most of the action. The states have a lot of power in this area. Health and community services, they're really where the firepower is. So I think that the federal government's got to play a facilitative role. That said, you know, we then got, I think the professions and unions themselves have to take a more active lead in this area. You know, I'm an industrial relations scholar. My original work was done in the metal and engineering sector. It led very thoroughgoing changes to its labour market, but that was done under the auspices of what was known as the Metal Trades Federation of Unions and the Metal Trades Industry Group. And these were multi-sector groups coming together, finding a common interest. And I think we've got to look at a multi-union, multi-profession collaboration to give that voice that's not just each sectional profession putting its own case, but actually coming together with a common voice. People will say I'm dreaming, but I'm just simply saying if you think we continue on our current path, I think you're dreaming in terms of solutions. And then finally, I think we've got to remember Australia's really lucky. We've got a thing called an arbitration system. We've got Fair Work Australia. And if things get really thorny and we've got to redefine skills differently, we've got an award system there we can work with. We've got an honest broker. It heads together and redefine things. So the answer is, I think the federal government can play a facilitative role. I think we've got the professions and the unions themselves have got to build up those collaborations like happened in the engineering sector in the 80s and 90s. But then ultimately we've got to recognise we've got a huge resource in the Fair Work Commission to think through how we can regulate our labour market in a more effective way. And it reviews awards every 5 years. There's a real possibility to think seriously about proper award restructuring.
Thanks, John. Jodie, what would it take?
Well, I think, you know, John's on the right track in terms of the industrial response. I think the best thing we could see out of the Jobs and Skills Summit is a recognition of the size and magnitude and criticality of the problem. We're talking about a workforce that is probably, as demographers say, the last that will be impacted by automation, if at all. And so the solutions are not going to be in the ordinary expectation of productivity, but rather in a different frame. We need to also understand the problem in its detail. You know, today at the National Skills Week launch, we had a number of discussions about the fact that we're talking about largely government-funded sectors, even though we have some contribution from the private sector and from user pays. And that the reality is that the affordability of the lifestyle and the well-being in the health system that we have is one of the things that has to be addressed in the context of what the labour force looks like. And as we talk about wages growth, it has to be critical to part of the solution, and pay and conditions have to be addressed as at a minimum. We also have to work in a way in understanding the way in which we adopt innovation and any technology to address and make that those models of delivery more effective, how the job roles come together and understand what that looks like, and how we skill that workforce. And so focus on how we might do that with the parties that John talks about as a minimum, but particularly with employers, government of all levels, and the union movement in some form of alliance where we're working together would be a great outcome.
Thanks, Jodie. I'm going to hold myself back from diving deep into the nitty-gritty, no matter how much I want to now, because I know we had a couple of questions come through. I'll hand back to you, Joseph, for our audience questions.
Great, thanks, Kira. So I've been monitoring the chat and the questions. A lot of comments talking about the importance of looking at pay, so decent work, as well as job conditions. A few comments around job security, how casual employees are often excluded from the development environment, the importance of meaningful works or aligning with people's interests who are looking for meaningful and fulfilling careers, creating more senior practitioner positions, also a nod to more data. Getting to the actual questions, there's a couple of questions here, one for Jodie and one for John. The first one to Jodie, I'm just going to read this out verbatim. You talk about creating clear and attractive career pathways. It feels that many of us have those in place, but the current environment is forcing us to cannibalize each other's agencies for scarce staff, while at the same time pushing salaries up to unsustainable levels. Any thoughts about a short to medium term healthier alternative?
Thanks, Joseph, and thanks for the question. It's not a simple answer. There's no doubt that there is competition for the same workforce right now in the marketplace, and certainly that poaching of or the enticing of staff from provider or employer to employer is happening. What we're seeing is the employer response that is getting the best outcomes is thinking about the culture and the experience of the worker in terms of employer value proposition. And they're thinking about not just having the career pathways, but facilitating those career pathways and creating the job around the individual and the way in which they want to work, being critical to be able to keep those workers. The churn in the sector is of numbers that have been reported, sometimes as high as 60%, sometimes as high as 30%, and as low as 30%. But there's no doubt that it's happening. What workers say is, yes, paying conditions must rise, but it's also about the experience that they have, and the experience that they have needs to have things that we don't often see, which is a commitment to offering time for training and development, the thought about the pathways of the individuals and what they might take. And we're trying to facilitate some of those things with recognition of skills that are delivered and developed in the workforce, and perhaps not recognise that may unlock career pathways that aren't being used. John said before, and it's quite right, personal care workers invariably stay as personal care workers, but why is that is the question. And employers are now finding ways in which they're locking them on and getting greater outcomes from them, taking them on an educational supervisory path where there is a great deficit in all of these sectors around supervision and training in the workplace. And we're seeing employers heading back to the traineeship model, working and learning. And they're the things that we think will head us in the right direction.
Great. Thank you, Jody. This might pick up a couple of your comments. A question for John that has come through is, thank you, John. I really like the term ensemble of skills. Can you tell us a little bit more about why you have chosen this term?
Sure. Look, as you know, or you may know, I've done a lot of work over many years with Lisa Wheelahan, and we've been very unimpressed with the notion of competency-based training and the idea that you can dismember a job into, hundreds, in some cases, thousands of units of competence. If you actually look at how healthy labour markets function, people don't just have a discrete competency in one domain and another competency in another domain and another competency in another domain. They link them together. So, and this is, I did my PhD on the metal engineering sector. If you look at a metal fitter and machinist, they weren't just really good with their tools and their lathes, and they weren't really good in their materials handling. They were actually really good in actually being able to read a blueprint. They were really good at being able to understand if a machine had broken down, how to unpack the problem before them. And so this is where I think the notion of occupation as an ensemble of skills is a better way of thinking about where we want to go for the future, as opposed to saying, how do we meet an immediate skills problem now? Because by the time you've solved your immediate skills problem, the world's moved on. The one thing we can be certain of is that things are going to change. So what we should be doing is, how do we give people the capacity to adapt to that changing environment? And that means they've got to have a repertoire of capabilities they can call back on. And that's why I use that notion of ensemble. You don't learn a set of specific capabilities and then apply them to a specific situation. It's that whole being more than the sum of the parts that's key. Now, that's easily said and hard to do, but I think that we're actually, if you actually look at how people move through the labour market, that's what's going on. People with care skills are ending up in clerical work. People with customer service work are ending up in care. They're already doing it. Let's actually go with the flow of the labour market and make that, turbocharge it and give them a deeper and more resourceful capacity to adapt.
Great. Thank you, John. So I'm just keeping an eye on the time. And before I wrap up, I want to hand over to Kira, perhaps not to do a full summary, but to do the impossible task of take all of that, really rich discussion and maybe give us one thing, Kira, that you've taken away, a new idea that you think we can take forward.
Yeah, thanks, Joseph. Not one of those occasions where we can say 1 hour and we've fixed it. It's all solved. Very much a jumping off point, as I think all three of our panelists today have pointed to. There's a lot of work ahead of us to move forward. I think what I've taken away from today, from each of our panelists, is the importance of sustaining the public discussion about this, really holding our government and our leaders to account, and the systemic leaders, about the criticality of the problem, using Jodie's words there, really looking forward to this being a feature of the discussion at the summit. I think the importance of the national conversation also taking place in a way where there is shared trust and value. This isn't about encroaching on existing occupational boundaries, but really trying to understand how the delivery and performance of integrated care has evolved, is evolving, and will continue to evolve, and how we look to plan ahead to make sure that we've got the skills and training and the skilled workforce to meet, support, and enable that transformation, and not get caught 10 years from now with an even more unimaginable crisis where the workplace practices have evolved and the skills and training system just doesn't have the capacity to keep pace. So thank you very much to all of our speakers today. I've really enjoyed the discussion. Thanks, Joseph.
Great. Thank you, Kira, for that wrap up. And I'd like to, of course, thank our panelists for their time and their insights. And I think what comes across really clearly, their passion as well for transforming the human and health sectors, and really putting out there what a transformational vision could look like. Thanks everyone as well for joining us today. If you're watching this webinar or watching a recording of it, please keep the conversation going by using the hashtag BSL Talks. And don't forget to subscribe to future events. The details are up there on the screen. We look forward to seeing you at the next BSL Talks. And until then, take care, everyone. Thank you.